Hello, I'm Dr. Wayne Rosen, and I'm a colon and rectal surgeon and clinical assistant professor of surgery at the University of Calgary in Alberta, Canada. Welcome to the first of a four-part presentation which illustrates the shortcomings of evidence-based medicine. I call this lecture Evidence-Based Medicine, a Critical Appraisal, or Why EBM Doesn't Work. And I'm going to show you something which I think many physicians have long suspected but find difficult to put into words. That is, EBM just doesn't work. Each part of this presentation is approximately 15 to 20 minutes in length. For those of you who do not make it to the end, I'd like to start by telling you my conclusion. I'm firmly of the belief that EBM is a misguided and ineffectual enterprise, and that advances and improvements in medical care over the past several decades have not occurred because of EBM, but rather in spite of it. I really mean this, and this presentation will illustrate why and how I've come to this conclusion. However, before I go any further, let me make a few routine introductory remarks. First, I have no relevant financial conflicts of interest. But I suppose I could stand to make a small fortune if I start selling limits of EBM-type paraphernalia, coffee mugs, shot glasses, underwear, t-shirts. I suppose there could even be an anti-EBM superhero-type doll, which we sell to children and to combat the evil EBM man, but for the time being, I have no relevant financial conflicts of interest. Second, and by way of disclaimer, the ideas and reflections discussed in this presentation are my own and in no way represent the views of the Department of Surgery or the University of Calgary. And third, over the years I've undoubtedly been influenced by many commentators and critics of EBM and absorbed some of their ideas. I have done my best to acknowledge their influence where appropriate. So now let's get on with it. Part 1, EBM, the dominant paradigm. Now, I know what you're thinking. How can anyone seriously assert that EBM is a misguided and ineffectual enterprise? I mean, it's obvious, isn't it? It's common sense, almost like motherhood and apple pie. How could anyone genuinely question the precept of using scientific evidence to justify clinical decision-making in medicine? How else could we explain advances in medical care over the past decades, if not the past century? Well, these are all very reasonable responses, but as I will show you, the nature of medical evidence and what influences our practice is a bit more complicated than might initially appear. So let me start off with a little bit of history. I graduated from medical school in 1991, and although it had been in the works for a long time before, EBM had its official coming out party in 1992 when Guyot and Sackett and the Evidence-Based Medicine Working Group published their landmark paper in JAMA. Like all physicians of my era, EBM had a deep impact on my training, and during my residency, EBM quickly assumed biblical significance. Like most people, I started off worshipping at the altar of EBM, but I must confess that I was a somewhat skeptical parishioner from the very get-go. Something bothered me about it, but I couldn't quite figure out what it was. The concept seemed so simple, so straightforward, so commonsensical. Simply use the best evidence along with my clinical judgment to take care of patients. It seemed almost too simple. But regardless how I felt, EBM quickly became the dominant paradigm as to how to learn, teach, and practice medicine, and an unprecedented proliferation of publications supporting it subsequently followed. As I mentioned above, the origins of my skepticism with EBM were almost immediate. I had a sense, and I believe most people still do, that there is a disconnect between the practice of medicine and the medical literature, that EBM just somehow doesn't seem to apply in the majority of circumstances. This sense of disconnect has increased over the years and has been amplified by the creation of clinical practice guidelines, which are nothing more than attempts to standardize the approach to various conditions based on the so-called evidence. They represent the distillate of EBM, but they just don't seem to work in most instances. Journal clubs too have contributed to my wariness of EBM. They all seem to follow a very predictable sequence. In my experience, they begin with a tedious, almost mind-numbing summary of a paper, usually presented by a resident. The attending staff then asks some well-meaning questions of the residents and students. Then we all proceed to tear the paper apart mercilessly and express our incredulity that a journal of this caliber would publish a paper so obviously flawed. And finally, after we've caught our breath, we proceed to tell each other about our personal views and experiences on the topic at hand, and what we really think is significant. This is the part of Journal Club which I usually enjoy and learn from. The actual papers or evidence are generally disregarded completely. In 20 years of journal clubs, I don't believe I've ever attended a journal club where we concluded that a given paper that we discussed was actually good, let alone great, or that anyone acknowledged that these papers might influence their practice. Journal club seems to function almost like the official opposition in government. The overt role is to counter and critique anything that is asserted. Industry-sponsored research has also played a role in my mistrust of EBM. Despite the apparent objectivity of our scientific approach to medical research, the results always seem surprisingly malleable to commercial interests. But more about this at a later time. And finally, a word about EBM Reviews. I cannot recall the number of times I've sat down to read an evidence-based medicine review on a topic and found it wanting. Usually it's a topic with which I'm familiar and keen to revisit. It's like sitting down for a nice steak dinner, but as I proceed to read, the meal metamorphoses into something else, and it feels like I'm eating uncooked tofu. It is insipid and unappetizing, but I sense that it's good for me, so I try to persist. I rarely make it to the end, and if I do, I find I'm still hungry and usually a bit nauseous. I've also noted a certain sense of social conformity about EBM. For example, when a resident or a colleague is asked what to do in a given clinical scenario, it never seems sufficient to just say, "I'd operate and take out the colon." Instead, there seems to have to be some sort of complicated evidentiary justification for the decision-making process. So instead of saying something like they take out the colon, they say something more like, well, as the Aleppi paper out of Cleveland demonstrated, 15% of such patients have a concomitant rectal cardiocerebral fistula, so I would arrange a thallium-infused CT enema and consult a neuroendocardioproctologist prior to operating and taking out the colon. Moreover, if you question much of the new research, you're considered a Luddite, and if you genuinely question the whole utility of the EBM enterprise, you're considered politically incorrect. But at the heart of my skepticism was a niggling sense that somehow EBM just didn't work, that it's the wrong tool for the job, and that it was frequently misleading and just didn't apply in the vast majority of cases in my clinical experience. So what this presentation really represents is the story of my journey to understand why I feel the way I do, and why EBM, which seems so compelling and commonsensical on the surface, just doesn't seem to work in practice. It is also a story which explains why EBM has become so dominant and why we adhere to it even when it's patently false or doesn't work. I'd like to start now with an anecdote from the philosopher Wittgenstein. Though there are some variations of this story, it's said that Wittgenstein used to wander around Cambridge and occasionally go up to strangers and ask them why it was that people believed for so long that the sun revolved around the earth. The response to this was invariably something to the effect of, "Well, I guess because it looks that way, Herr Wittgenstein." To which Wittgenstein would then respond, "Well, how would it look if the earth rotated around the sun?" The point of this anecdote, of course, is to illustrate how our preconceptions influence the way we perceive phenomena. The geocentric conception of the universe, you may recall, was based on the assumption that the humans and the earth were the center of the universe, and that all these celestial bodies revolved around it. The belief informed the way we conceived the universe and celestial bodies. I mention this anecdote now because it took me a long time to come up with a compelling and comprehensive way to characterize the problem with EBM. But after a great deal of time and thought, it occurred to me that EBM is in many ways analogous to the geocentric conception of the universe, in that, like geocentrism, it has become the dominant paradigm of our time, and like geocentrism, it gives rise to all sorts of inconsistencies and anomalies in the phenomena we observe. And finally, like geocentrism, it's based on a fundamental misconception or shortcoming. Like all analogies, this one does not have perfect congruence, but it's close enough and elucidates the problem. So in the remaining portion of this lecture, let me start by briefly discussing EBM as the dominant paradigm. I don't think that anyone in medicine these days would be hard-pressed to concede that EBM is the dominant paradigm as to how to teach, learn, and practice medicine. There is, of course, some question as to exactly what we were doing prior to 1992 in the official introduction of EBM, but the overall dominance and supremacy of EBM, I think, is incontestable. Medical students at every university receive instruction on evidence-based medicine. They are expected to carry out evidence-based projects on various topics throughout their medical curriculum, and they learn from that EBM is the fundamental way to learn and practice medicine. Residents are also completely indoctrinated into EBM. They read and quote no end of evidence-based reviews, and if you ask them about another way to practice medicine from an evidence-based way, they look at you in a puzzled format. Journals, meetings, and rounds are all based on evidence-based medicine. However, perhaps the supremacy of EBM is no better illustrated than at Amazon.com, where if you search the phrase evidence-based medicine, you'll get somewhere in the neighborhood of 17,000 hits as of February 2015. You'll get everything from evidence-based laboratory medicine to evidence-based obstetric anesthesia to evidence-based critical care and evidence-based sports medicine. This one on evidence-based patient handling looks particularly interesting. There are literally thousands and thousands of such titles, and this is but a small taste. Even the alternative or complementary healthcare industry wants in on the action and has a number of evidence-based publications. There is much that could be said about this, but that for a later date. Interestingly, if you search the phrase just evidence-based, leaving out medicine, you will get around 156,000 hits. That's 9 times as many as with evidence-based medicine. You'll find everything from evidence-based techniques for preventing violence and assessing the impact of the U.S. Patriot Act to evidence-based coaching, school counseling, massage, brand development, and interior design, to name but a few. There is even a book on evidence-based horsemanship. Yeah, that's right, evidence-based horsemanship. No doubt there will soon be some new versions of old classics in the evidence-based vein. Imagine what your cooking and lovemaking could be like with these titles. And for those of you who crave more evidence in your spiritual life, imagine what salvation the evidence-based Bible could bring. There is a great deal we could say about the proliferation of the term evidence-based, both in medicine and society as a whole, but I'll address that at a later discussion. Suffice it to say that the phrase evidence-based has become the mantra of modern medicine. Within a mere 20 years, EBM has become so much the dominant paradigm in medicine that I dare say that all physicians who trained in the past decade cannot even fathom a time before EBM. It would be like what historians refer to as prehistory. There may have been some primitive drawings on the cave walls and some interesting tools to be found, but basically it was a time of ignorance. Anyway, this seems like a good point to conclude the first lecture, and I'll continue with part 2 shortly.